Hello, my name is Dr. Alan Saby. I'm a clinical professor at the Family Institute in Northwestern University, here to introduce and describe our upcoming paper to be published in the Journal of Marital and Family Therapy, titled Processes and Outcomes of an Emotion-Focused Family Therapy Two-Chair Intervention for Transforming Problematic Parenting Patterns. This paper is a psychotherapy process research study, a task analysis of a two-chair clinical intervention from emotion-focused family therapy. The intervention is used with caregivers across the lifespan to address problematic parenting patterns, to increase awareness of caregivers and their children's emotions, and to help process these emotions in order to support caregivers in more adaptive and attuned behavioral responses. Data from 16 caregivers with 4 different therapists indicated that the intervention helped to resolve their caregivers' fears and emotions and increase their confidence in their caregiving efforts, particularly through the act of their caregivers taking the perspective and speaking from the perspective of their child. The task analysis results showed more generally the process of change for the caregivers, and highlighted that the deeper the activation of the love-based fear during the intervention, the fear that is fueling the parents' behavioral responses, the greater the resolution and confidence that the caregivers reported at the end of the intervention. More broadly, the study showcases that although experiential interventions in family therapy may take more time to learn and to master, they are both efficient and effective when working towards more enduring second-order change in psychotherapy. We also feel that this specific intervention can help parents and caregivers provide a safer attachment relationship in order to support children in their healing and in their development. Future research on this intervention should include a larger and more diverse sample, to include a follow-up assessment after the intervention, as well as to include children's outcomes along with their caregivers. The clinical implications are pretty straightforward. We encourage interested therapists to read about the intervention and seek the necessary training and supervision in order to use it with caregivers. In the meantime, therapists could encourage the awareness of caregivers' own emotions in their relationship with their children, particularly their love-based fear, in order to have a more complete and effective understanding of difficult interactions within their families. We hope you enjoy the paper.